How do we get people to care? All the rest of it is noise. It is so hard and distressing. The pay that people really need and deserve hasn't been funded. It's such a great career opportunity. Be bold, be hopeful, be imaginative, be creative, because there's no money. What would the risk be of disrupting those established relationships and moving somebody from their home? I think the potential for digital is huge, but actually the funding hasn't kept pace with that.
Voices of Care, the healthcare podcast.
Valerie, great to see you and welcome to Voices of Care.
It's lovely to be here. Thank you for having me.
No, it's great. It's been a while since I've seen you, and I think you're coming up to 5th anniversary, not far off, since you took the helm at Choice.
Yes, just over 4 years. Unbelievably, it's gone by very quickly.
Yeah, I think you chose your time in during the pandemic. I think was when you took over.
I did. Yes, I joined in the pandemic, which was. Yeah, I mean, parts of it were brilliant. It was great to be able to come in and support people in that time, but also it was really difficult. I couldn't go in and meet colleagues and things like that. But yeah, I happily were out of that time.
Absolutely. And actually the market, we can quickly look at the care home market. Lang Buisson, of course you'll know, have produced earlier this year, at the end of February, their market report looking at care homes. And they highlighted quite a significant increase, 26 billion the market value of the market from 17 billion in 2021, 40%. And the forward to the report talked about occupancy rates coming back, investor activity. What are you seeing in terms of the market generally? And it's grown and it remains of interest to investors.
Yeah, I think that if you look at the King's Fund, have actually just also done some analysis. Yes, the 360 report, which I think exactly tells us what's going on. So what we're seeing is that because of the constrained budgets within local government and local authorities, actually fewer people are being supported, partly because of the increase in costs, which are driven by the hugely deserved increases in minimum wage. So actually looking at headline turnover figures is possibly not the best indicator, because
it's a fee inflation driven, effectively.
Yes, actually, yeah. I think the question is, are the people who need support being able to get that support? And I think the King's Fund analysis would say that's been quite difficult, and I guess looking ahead, I think that's going to continue to be quite difficult.
No, absolutely. I think they've shown a decrease in the number of people getting long-term care over the last decade or so. But at the same time, I think there's been activity in the sector. It's still the demographics support long-term investment. Choice, wanted to come on to that. Specialist area, learning disabilities, people with autism that you support. If you can tell us a little bit about that. But over the last few years, you've been driven also by acquisition. So clearly great faith in the market.
Yeah, so Choice has a long history of,
over 30 years now.
Yeah, we did a 30-year anniversary a couple of years ago. And actually, I was saying to you earlier before we started, there's a reasonable number of colleagues who've been there through that time, which is extraordinary. There's a kind of lovely core of depth of experience. And so the organisation has always been about supporting people who need to draw on care just to be able to, go about their lives and thrive. And many of those people have got learning disabilities, autism, increasingly mental health needs as well. And we do have, I think it's now about 110 different homes, and from sort of cottages in rural Wales to bigger sort of flats in the centre of Nottinghamshire and stuff like that. So lots of different places, obviously, where people choose to live, and we have lots of colleagues supporting them to do what they want to do. And you mentioned acquisitions. So we have, I think one of the things about the way that care is delivered that people misunderstand is that it is actually most providers are small, medium enterprises. In fact, actually, the biggest providers only account for, I think, 5 to 7%.
A much smaller percentage, fragmented market.
It's hugely fragmented, and actually, those small, medium sort of providers are the lifeblood of the support. Little local services employing colleagues locally to support people, and that's really where we've done some very carefully selected acquisitions where there's really high quality providers who have got our kind of shared values about putting the needs of people we support first, and also in areas where we, in our discussions with commissioners, know that they have a need for further support. So we've sort of, carefully joined providers into the group where we think we can then sort of use their relationships and depth of expertise to do more for people in those local areas.
Because the services that you have are a range of services. I mean, there's residential settings you've talked about, day settings, and some people needing 24/7 care.
Yeah. I think increasingly the sort of distinctions, I mean, I think as providers we tend to sort of talk about, these sort of that's really the sort of regulatory frameworks as to whether people are supported in a residential registered service or supported living. But actually for the people that draw on our support, it's their home, it's the place they go to, maybe for support during the day. And that, the same as you and I, people choose to, to sort of live and go to different places. So we have colleagues working in lots of different places in England and in Wales as well.
Absolutely. Now, you talked about the wider setting earlier in terms of we've obviously back in March we've had lots of debate and discussion in the sector. We have a social care commission. You talked about the King's Fund report. The National Audit Office came out with a report back in February highlighting really the financial sustainability of local government was very much brought into light. So lots happening in the sector, and the Social Care Commission does promise to answer some of the critics' voices that have been raised very loudly over the last few months.
Yeah, I think it's really clear that funding, if you look at the King's Fund and the National, all these reports that you point to, it's really clear that there are increasing mismatches over a long period of time. They sort of go back 8 years, and you can see as we talked about, the much needed increase in people's care workers' pay, but actually the funding hasn't kept pace with that, and also the need, people are living longer, which is fabulous, but actually less people are able to actually get the support that they want, and I think the Commission's challenge, I don't think, is to identify what the issues are or what the solutions are. Actually, I think we're on, I don't know, Commission number whatever. It's just the fundamental issue is that there is no way of the government working out how to fill that gap in funding. That's the conundrum. And actually, because the work that we do is less of a political priority, then some of the further inquiries and commissions and things are a way of pushing out that funding question for a bit longer. So I think the nub of the challenge for all of us as kind of leaders in the sector is actually to sort of think about how do we get people to care and understand about how phenomenal the work is, the opportunity it gives to people, how much value that contributes. And I think if we can elevate and have people understand that, then we might have a chance at unlocking the funding. All the rest of it is noise because there's no money. So we've got to, I think, try to get people to understand and care in order to get some different funding solutions.
So really, in essence, the government knows the problems, doesn't have the money or are not prioritising it, and effectively that's a communication issue now. So you've highlighted about a messaging issue now, and it's interesting. I think you've mentioned the work of Social Care Future, Lancaster University, highlighting that actually the advocacy and the way in which these questions are framed has quite a powerful effect in terms of grabbing policymakers and all stakeholders' attention.
Yeah, I think this is my kind of reflection on the whole, having thought long and hard about, gosh, how are we going to try and, sort of advocate.
It becomes a broken record, doesn't it?
Yeah, I think that is the nub of the issue. And it's completely understandable, isn't it, that it is so hard and distressing for people who draw on support, for colleagues. It's really unsettling for providers who are, I think people don't maybe understand that actually and if you think about the fact that, as I've said, the vast majority of providers who are employing colleagues in the sector are small and medium enterprises. Essentially what happens is you know that in April the minimum wage is going to move to wherever that is set each year, and then that obviously you sort of underpins how providers want to set pay. But what I don't think people realise is that then what you have to do is hope that you can then go to all of your local funding authorities and hope that they will cover that. But you don't know in advance. It's not a kind of logical economic circumstance that you might otherwise embark on. And I don't think people understand that. And of course, if you sort of go back to the King's Fund numbers of, pay's gone up 17%, over 8% of funding for working age adults has gone up 13%, then actually over time, the cost of
big impact.
The pay that people really need and deserve hasn't been funded. And actually, if you look forward, that's what the issue is. So we've got to. So what that does, it means if you hear people talk about care, often it's social care is in crisis. Yep. We're on our precipice. We're going to have to,
collapse.
We want to tell people of the distress that people are under. However, I think what that does is unfortunately mean that people, there's a lot, isn't there, just now? I don't know about you, but I kind of don't really watch the news at night because I don't want to listen to it right before I go to sleep. And so adding to that cacophony maybe means that the people that we need to be able to listen and engage actually can't. The Social Care in Future is this brilliant sort of people-powered movement that want to sort of influence and imagine a positive future. And they've done research that proves exactly this, which is the more we talk about an imminent crisis and a precipice and things, the less people are engaged. And actually I think what we need to do to unlock the money is to flip their narrative, be bold, be hopeful, be imaginative, be creative. And I think then we might have a chance of unlocking some of the solutions that we desperately need.
It's interesting because the language has been very critical over a period of time. And I think the work that you're developing with other leaders and discussing, I think some of the evidence shows that actually if you get the messaging wrong, there's also misunderstandings, isn't there, about social care? Because I think there's some research done showing that maybe a third of people still think that the NHS provides a significant proportion of social care, and a lot of it's free at the point of use, which is interesting after all these years. Yes,
that's exactly, we're immersed in our world, right? And we use all these sort of acronyms and terms and things, and we just think that, everybody gets it, right? But the truth is most people don't. I mean, I think you're rightly referring to the Health Foundation have done some polling, and if you look at the current government, part of their proposed solution is to look at a national care service. Yep. Well, actually, only 75% of people have never heard of a national care service.
Despite the fact that it was in the manifesto.
Yeah, exactly. I think in 2022, as you say, I think it was 30% of people thought the NHS provide the care, and 38% of people think it's free at the point of care, which is so you can really see the challenge
it's not clear.
that we have to win hearts and minds to our cause. And I think so I think we...
So the positive messaging, I mean, this reference has been made in the literature to President Obama's campaign, which was couched in yes, we can, much more positive type of language. You talked earlier around bold ideas. I want to see if we can touch upon some of those now. And I think the mission or the vision that you've been talking to other leaders about is a compassionate, well-resourced, relationship-centred.
Yeah. Yeah, I think one of the things that is absolutely in the heart of care is if someone needs to, if you or I need to draw on some support and able to live our life, what makes that really positive and possible is if we have people around about us who know us, who understand us, who, can understand what our hopes and aspirations are, on big things and small things.
Yeah.
And also, I guess also if we have people around about us who believe in us, actually, I think that's when that sort of nexus of a relationship exists, then that is such a powerful place. We see people who draw on care live, the fulfilling lives they want to live, but we also see how that improves their health outcomes. But it's not just the impact for them. It's also, if we look at, we've done some research on this in colleagues in Choice, but it's the same across the piece. There's also a very positive effect for the people who are offering that support. They develop confidence and skills and listening, and we also see their well-being improve. So there's this really, really powerful possibility of a relationship. And when those networks, and it doesn't need to be paid, that can be family relationships, it can be friends, it's a sort of big network of, when you get those networks of relationships round all of us, then things work, right? But what social care sometimes does is talks about, hours and prices and services.
Yes.
And this isn't a commodity thing. It's actually much more profound and complex than that. And I think what could be really exciting is if we can get to that, these are really powerful relationships. That's something that can energize people, something that people can be proud of. And I think if we can, get into the stories of what that means for care workers and for people who draw on care, that I think becomes quite interesting.
That's a powerful moral argument, operational argument. It's also an economic argument, because I think there is evidence, I think you've alluded to it, with effective advocacy, every pound spent on effective advocacy,
yes.
You have a financial background, of course, pays back not only to social care but also to the NHS.
Yeah, but it makes sense, doesn't it? So we, if we can think about, there's a lot of, I had a mum contact me last week, and her son's where he lives, the commissioners for her son's care have somewhat unbelievably offered a 0% uplift in his fees for this year, and she is desperately worried that the place where his home for 9 years, where he has all these established relationships, that might be at risk. And you can see that. We've seen Mencap and other people, and I think if you sort of think about that, then clearly that local authority, their funding is under such pressure that they. But actually, what would the risk be of disrupting those established relationships and moving somebody from their home? Actually, that potential cost and risk is significant. They might miss signals of health deterioration. The move in itself might cost, and actually the
cost could be much more significant.
Exactly. So it's that sort of, how do we think more in a more joined up way about where the investment and things. I mean, it's very much the same discussion that has been had at the moment about, welfare and things. That you sort of can't solve one part of it without thinking about. So I think it's absolutely fundamental to think about, where those relationships are. And actually that's got such promise and potential. If you think about, there's discussion just now, isn't there, about AI and technology and how is that going to change jobs in the workplace? Well, if you come to care, not much, because what it can do is take away some of the dull bureaucracy and make it a bit safer.
The crushing burden of admin.
But you're actually still going to need a person and a relationship, right? So this is work that becomes more and more valued as we sort of look forward, I think. And I think if we can get excited about the sort of real potential, then we can
maybe get people engaged, including all policymakers. You talked about bold ideas. So part of the movement around social care future and your own discussions with leaders talk about 5 bold ideas. We're not maybe not able to cover all of them. One is fair funding. So I think we all understand what that's about. But the other one that you talk about, of course, is elevation of the workforce. And that it'd be interesting to talk about that, because that goes beyond but pay and conditions, but it's elevating the work that's actually done.
Yeah, I mean, I get really excited about this. I was listening to Rebecca on this podcast, also being, very. So I think it's about 1 in 20 people in the UK are working in care, right? That's huge.
That's massive.
But you kind of think, well, where is the voice and the representation for people there? And I think. If you maybe sort of compare that to health, where colleagues working in the health system have very strong representation, I think there is huge potential to understand and to hear the expertise of people who work in care. So, like, if I just think. For example, in choice, and I think this is the same through lots of different places, we don't do anything without going to colleagues, and particularly the sort of managers of services, and say, what do you think? Like, what's working, what's not working? How can we do this? How they are they are the absolute, sort of experts. They've typically been working, I think 80% of registered managers in our organisation have been promoted from within. I think that's actually quite typical. We're really proud of that, but I actually think it's quite typical in care. And if I went to retail or to hospitality or to financial services, that is a sort of opportunity that for expertise and development that you would cry out for. It's phenomenal. It's such a great career route for colleagues who want to kind of learn on the job, but there's also really lots of formal learning, but you can progress really quickly. It's such a great career opportunity. And as I said earlier, we can also see evidence about how life-changing that is for colleagues and how much experience and expertise there is in the sector. So the question for me is, how do we represent that better? How do we tell the stories of all the people who have found their energy and their experience and their confidence, and their skills and their leadership skills and their ability to listen to people who might communicate differently from you and I, maybe not verbally. That's just like such a deep experience and expertise.
As I was listening to you, you said it earlier, we're sort of immersed in the sector. There's this world outside the sector that doesn't know. And I think that's a really powerful point, because within health, you have organisations that are very vocal on behalf of nurses, quite rightly, doctors, absolutely, care workers. That's a different, there's some great work being done by the Care Workers Charity, of course, who you know and we know very well. So the question then becomes, how do we do that?
Yeah, and I think that's, as you say, the Care Workers charity recently convened lots of different care workers together, and actually that group said, we think we should be registered and recognised. And I would be completely in support of that. I think let's get you registered and recognised so that all of these facts and figures and statistics that I'm talking about can be used in this discussion, so that, who should Baroness Casey be talking to? The people
actually deliver.
Yes, exactly. And the people who draw on care. There's people like, you and me and lots of others, but actually how does she make sure it's truly representative of the people who draw on care and those people who are, who are supporting them? Where'd you get that? I think it's really important for us to think about how do we elevate these amazing colleagues in care.
Absolutely, no, and you're clearly very, very passionate about that. Let's go to one of the other bold ideas, and merge two of them together, which is the community-based centred support you alluded to earlier. Volunteers. It doesn't have to be paid. It can be informal, but the people who draw on care. This idea that actually they have a voice and agency to co-create. What's been your experience on the ground of that? Because that's been advocated for a little while by some, like Social Care Future, but a long way to go.
Yes. So I'm going to tell you two different stories actually to illustrate this, I think. So the properly listening to the people who draw on care, I think it was IHI years ago that used to talk about, instead of saying to people, what's the matter with you? What's a much better question is to say what matters to you, right? And I think that just epitomizes where sometimes some of these things can go wrong. I was talking to a parent months ago, and he was describing, my son has this and he has these needs and I was saying, but what does he love? Like, what gives him joy in the morning? Like, I get all that stuff, but
we don't hear that question that often. We just don't.
No, that's the thing. And so, just before Christmas, I had a really moving email from the sister of a lady we supported who lived in lived in her home for 10 years. And her sister said that she wanted me to hear the eulogy that she had read at her sister's funeral about how happy her sister had been in her home. She'd lived in 15 or 16 different homes and hospitals since she'd been a young girl until she came to live in her home. And her sister said that one of many things that just made a difference was the team there took so much time to try and understand where and how this lady was happiest. And actually her thing was animals. She grew up on a farm when she was very young, and the team figured this out. And so she would regularly visit and volunteer at a farm. She was really into Doctor Who and could watch as much. But I think it was the farm that really
ignited her.
Yes. And her sister sent me the copy of her eulogy talking about it. And that, I think, is just the epitome of when we talk about, services and hours and needs and care ratios and things, actually what was important for that lady is
a lived experience.
Is I want to be with animals. Like, that's my place, right? That's where I'm happy. And I think it's making sure in all of this stress and pressure that's the question that we're asking, like, what's your thing, right? What works? And then this kind of community thing, I think, is really important. We're talking about moving. It's one of the big shifts, isn't it, in the NHS? Absolutely, and moving things into the community things. But it's like, what does that mean? What does that really mean? And one of the things I inherited at Choice, which I really love, is there's this huge social network in the organisation. And one of the highlights of everybody's year is we have a talent competition with Choice Got Talent.
Right.
And the team that run it travel all over and do regional auditions, and there's all sorts of skills and abilities, and then we hire a huge venue and have the most amazing day, and lots of people can come. And actually, if people don't want to come, we stream it live, we do online voting. I mean, it's just fabulous. Anyway, I was visiting a home down near the coast, and I could tell one of the girls was, and she sort of came up and she said, "I recognise you from Choice's Got Talent." And I was like, "I remember you. You were just fabulous." She was quite shy, and she kind of opened up and she said, and then she, sort of told me her kind of story, and she talked about how important that was for her. She likes singing, but didn't really have a way of like
expressing that.
Yeah, where am I going to sing? Yeah. But she was supported and encouraged, and it's a really fab environment. It's like everybody can be their self, and some people get up on the stage and then it takes a wee bit of time till they want to get going, and everybody is fine to wait, and they're just, it's just fab. Anyway, she had said this was just, the sort of beginning for her. But sort of better than that, she then met a couple of other people there who lived nearby.
Yep.
Who are now her friends.
So they were unconnected. They were unconnected prior.
Not before she did it. But they also have barbecues locally and invite. She jumps on the bus now to see her friends, and she has. She's just got a local busking license, and she's going to start busking along with the manager of the service, who unbelievably plays the ukulele. But
goodness.
What you could see is how. It's not, sometimes we just think about the person who draws on care and then the people that are with them on a day-to-day basis, but it's much, much more, it's more than that. It's like, what do you want to do in addition to that? Do you want to be able to sing? Do you want to find a place to sing? Do you want to have friends? How do you build relationship with friends? How do you do that in a way that, and I think...
Giving the space for authenticity.
Yeah, but I think just finding the ways and means and the desire for all of that is also really important. So, I think that can also be such a important part.
So we talked about two of those bold ideas: the people who draw on the services, people who provide the services. We talked about Care Workers Charity as a vehicle for the latter. In terms of making sure Baroness Casey hears from the people who draw on the services, what things have you seen, or do you think could be done to make sure that voice is really clear?
Yeah, I actually think Social Care Futures are doing a super job. That is a movement convened by people who draw on care. Yeah. They've been really vocal in working the recent inquiry in the House of Lords. Yeah. I think you can see the influence of their...
We were very privileged to have Anna Severwright here with us on the podcast, who's absolutely brilliant.
She's fabulous. So I think it's just that elevation of, I think we all have a role to amplify the voices of the people who draw on care rather than pontificate on our own views. I think that is completely secondary to,
That's a really important shift.
And I think if we can, collaborate in that sort of mindset and perspective, what's more interesting and what's going to get people engaged and hopefully, help solve the funding conundrum. They're not interested in me, but they're probably really interested in, some of the...
There are a lot of people interested in you, the ones who are on the podcast.
But
I know what you mean.
What the stories of the people, what's working and not working for them, and how do we solve for them?
Absolutely.
Yeah.
So moving from the very quintessence of care, which is the people, to an adjunct, which is one of the other bold ideas I want to just end with on this part of the podcast, is you've advocated the importance of technological innovation, AI. So just briefly touch upon how do we position that as being an enabler to promote the sector?
Yeah, I think it's part of like a really exciting future, isn't it? Care has maybe been slower than other areas in to adopt technology, but actually I really see it going at pace now in so many different areas. If you think about somebody who is really sensory, being able to, shout at your lights and have them reduce is, how fabulous is that?
Science fiction that not long ago to be able to even do that.
Yeah, but it's really, if you're sensitive to sound and light and things, like having control over that in your environment is so much easier.
Absolutely.
But things that digital care records, we're kind of trialing things where you go into the kitchen and you have to remember that maybe your food requirements are different than my food requirements. Well, there's like a little code I can just scan and it says...
It takes care of it.
Yeah. You're like, wow, that's just, that's making everything easier and safer. So I don't think it replaces. I'm all for the human connection and relationship, but it frees up your time from... writing records and having to read things. And, it can just, and also I think it can be really empowering for people who draw on care and for colleagues. One of the most popular things we've done was we have Choice Hub, which is, it's almost, I would say, like a sort of internal Facebook kind of Instagram thing.
Right.
And honestly, like if you ever have a bad day, I just sort of sit and have a little, it's like, Tom did this and we were off here and so-and-so just got our level 3. And then everybody like connects with it and they're like, oh, well done. Like, that's just fabulous. And,
it takes the focus onto
it's so good. And it connects all, as I said, we've got sort of 110 different settings, but actually it's like really energizing because, it brings together all the people that are drawing support and call it, because they love seeing people sort of thriving. So some of these tools that is so simple. That's not complicated technology, really powerful. Like just, so I think the potential for digital is huge to free up energy for...
Well, hopefully there was a report by the County Councils Network in February showing that 9 out of 10 councils are actually using AI to varying different degrees, removing potholes to all the other public provisions. So, and I wanted to talk about councils, if I may, just to bring the conversation to a sort of broader context in this whole advocacy piece, because they're going to be very important partners in any conversation, given the fact that they commission so much of the care. ADAS produced a report, I think it was called Time to Act, where I think they're beginning to recognise that the narrative, as you've advocated, does need to change.
Yeah, I think you can begin to see that. I think one of the structural challenges is, this is not a sort of centrally commissioned single area of kind of public expenditure. It's complex, right? People who draw on care, huge workforce, very fragmented provider, but of course so many different commissioners as well. Like and their structures are changing as well.
It's quite a balancing act, because the National Care Service, obviously Scotland were along that road, which they had to scrap. So as you say, it's a very complex moving parts. Yeah,
but I think the question is, do we all think maybe flipping the narrative a bit and being more bold and energetic and hopeful? Do we think that might get the attention in order to help solve some of the sort of sustainable funding things? But you can definitely see lots of these lead organisations beginning to pick up this kind of hopeful, more narrative. So I think the key is, can we get there quickly? And just kind of be bold and hopeful for the future.
And then one final question, if I may. We're well ahead of any initial findings from Baroness Casey, and it's obviously the final report's 2028, et cetera, But given your long experience, given what you're calling for as a change of narrative, what would you like to see come out of the Commission, perhaps in the short term and broader term? Fairer funding, of course, but in terms of practical things that can help all stakeholders, including providers.
Yeah, I would just actually like to see the Commission elevate the help in this task of let's educate, elevate, energise, give recognition to the importance of the energy of the people who draw on care and care workers. I think if the Commission can help us all do that, then actually we get to the and I know that Baroness Casey is really, really well respected for that as well. So I'm very optimistic about it. But for me, that's the key to the secret, is can we? Yeah, I actually think she probably knows, the answers right now. But the key is how do we persuade of the need for the funding, and I think we do that by being hopeful.
Well, on that hopeful message, hopefully the Commission and all other stakeholders are listening. Thank you very much for your time, Valerie Michie.
Thank you very much.
No, really enjoyed it. Thank you. If you've enjoyed this episode of Voices of Care, please like, follow or subscribe wherever you receive your podcasts. And if you want to learn more about how we're turning the dial on the health and social care debate, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much for joining us today, and I look forward to seeing you on the next podcast.
Voices of Care, the healthcare podcast.